everyone, depending on whichever location you are. I want to appreciate everyone online at this moment because we have a topic which is of great concern, especially in the area of public health. And we're going to look holistically on hepatitis. We're going to look at hepatitis. I know this is one of the public health threats that have been overlooked. That's why the fact that it can be very, very, very dangerous. It's one of the area that have not been properly looked into. But as we go along today, we'll begin to unfold certain things about hepatitis so that we all will learn one or two things before the end of the day. Now, the word hepatitis is actually
Sorry, Dr. Victor.
from...
Dr. Victor, sir. Dr. Victor.
Yes. Yes.
Okay. Your picture is not, your video is not showing.
Okay.
Yes.
Oh, can you see me now?
No.
Hello.
No, sir. I can't see you. Can any of my co-hosts see him? Maybe it's my network. Is any of my co-hosts see him?
His video is on. Yes, he's coming up. You can see him.
Okay, yes. Go ahead, sir. Okay, Dr. Victor, I know before you go on, there are so many questions that has been already sent to us, and I don't know if we can take it, the questions, or you go through it before we take the questions, sir.
Let me just go through it briefly, then we can go through the question.
Okay, go ahead, sir. Thank you very much.
Briefly, we'll go through the question. So, like I said, hepatitis is from the words hepatic, which has to do with the liver. And if we can know, we know that liver is one of the very important organ in our body. It is the liver that takes a whole shit, a whole lot. Anything you put into your mouth may end up finding itself in the liver or processing before the body can generally absorb it. So if you are an alcoholic, all the alcohol you take must pass through the liver. If you take any medication, it must pass through the liver. If you eat food, they will pass through the liver. So that is the place where detoxification takes place. And then you can imagine when something now begins to cause problem there, then it's a serious health challenge. It's a serious health issue. So we'll be looking at what is hepatitis. It is actually when the liver is inflamed. So we say it is an inflammation of the liver. It is often caused by viral infection. And not only viral infection, there are some other things that can cause hepatitis apart from the viral infection. And when we talk about the viral infection that causes hepatitis, we have hepatitis A virus, we have hepatitis B virus, we have C, we have D, we have E virus. And some other things that can actually cause hepatitis in the liver are
okay, Dr. Victor. Are you there, sir? Okay, I think the network has thrown him out. Let's be patient. I know he will be back. So please, Dr. Victor is already on the topic and is explaining what hepatitis is all about and how it can affect.
Hello,
so, Dr. Victor,
can you hear me?
Yes, we can hear you. Yes, we can hear you. Go ahead, sir.
Thank you very much.
Welcome, sir.
It's okay. So I said earlier that there are different types of viruses that can actually cause hepatitis. We have A, we have B, we have C, we have D, we have E. And then apart from the viruses, we also have toxins that can actually lead to hepatitis. We have autoimmune disease, and then we also have medications. So some of the drugs we take that goes to the liver to metabolize or break down, some of them can cause inflammation of the liver, and then will lead to hepatitis. Now, having said so, the question now is, how can hepatitis be transmitted? They can actually be transmitted from depending on the type of hepatitis. For example, the A and E are typically spread through contaminated food or water or close contact. The hepatitis B and C, they are primarily spread through bodily fluids such as blood and semen. Then hepatitis D, that can only occur in an individual who already is infected by hepatitis B. So what it does is that once it enters in the presence of hepatitis B, it goes and then worsens the situation in anyone who has hepatitis B. And there are some things we can actually see or look out for to know and suspect that this might be a case of hepatitis. One of such is that there could be yellowing of the eyes or skin pigmentation or yellowing of the skin, which we call jaundice. So when you begin to see yellows in a white portion of the eyes, one could suspect that there could be a problem in the liver, okay, which may be due to inability to break down bilirubin in the liver. And then one could be experiencing fatigue, one could be actually have loss of appetite, and then one could be experiencing abdominal pain, and then one could, have a very dark urine. When you urinate, instead of the normal straw color or yellow color, then you have it dark. Then the stool can also become pale. Now, so those are some of the things we look at and we say, we might suspect that there may be a problem with the liver. And then we can say, okay, can you go and do hepatitis tests? Let's confirm. All right. Now, one of the ways we can actually diagnose hepatitis is through blood tests. Sometimes it could lead to imaging tests, for example, CT scan or MRI. And then also sometimes one can do liver biopsy. Having said so, like I mentioned earlier on, that there are different types. Let's just take the types now one after the other so that we will know how we can separate and differentiate them. Number one, hepatitis A virus. It is highly contagious. When we say it's highly contagious, it simply means that one can easily get infected by it. All right. So it can be spread through contaminated food, water, or through a close contact. So prevention is very, very key. And then vaccination is available. So we have hepatitis A vaccine. And one of the key ways to prevent this is taking the vaccine when you are not already exposed to the virus. Then we have hepatitis B, which is more common, or the most common of them all, and also is very, very deadly. Okay, now this can be transmitted through the bodily fluids, like the blood. It can be transmitted from your semen, and hepatitis B also have vaccine. So if you're not yet infected, if you test negative, you can actually go and take the vaccine to protect you from any other exposure to the virus. And then we have hepatitis C. The hepatitis C is spread through infected blood and can lead to chronic liver disease. And this can lead to liver cancer. And most times, symptoms do not even appear even after some years of infection. So you are exposed to it, it's there, but you may not experience any symptoms after some years. But like hepatitis B, one can easily start experiencing the symptoms as quick as possible. And sometimes it could be acute, and then it could be chronic. Then we have hepatitis D. The D will not only come into the body, or one cannot get infected except you're already exposed to hepatitis B. Then it's easier for you now to contact hepatitis D. And when hepatitis D comes, it worsens the situation and become a very serious issue. Then we have E. E is typically spread through contaminated food and water. And this hepatitis E virus can actually cause infection. Now, having said that, let me just take us a little bit through the pathophysiology of hepatitis. So, when it gets to the liver, what happens to the liver, and how does the liver get damaged? Now, each time these viruses get to the liver, they always elicit an immune response. The body will elicit an immune response to fight. And then in the process of eliciting an immune response to fight, the viral hepatitis can lead to collateral damage to the liver tissues. And this damage will lead to an inflammation and fibrosis. Now, the fibrosis will now lead to the formation of fibrous tissues, which is fibrogenosis, which can lead to scarring or cirrhosis of the liver. And this can lead to liver failure. And then there's increased risk of hepatocellular carcinoma, which is liver cancer. Now, the virus, because they are virus and they have RNA or DNA, they can replicate. And as they replicate and, replicate itself, the virus in the liver, they can lead to hepatocytes, which can lead to the increase in viral load. And that is why most times when you want to treat someone with this particular virus, you first of all want to know the viral load of that person, so that when treatment commences, you begin to monitor if the viral load is increasing or decreasing. By then, you will know how effective the treatment is, if there's a need for you to increase the dosage, or you maintain that dosage, depending on how the treatment is going as to reducing the viral load. And one thing that normally happens is that hepatitis they have consequences. They have what we call consequences. And the consequence of hepatitis is 1 and 2. One is acute liver failure. Now, which will be several damages in the liver, which can lead to liver failure. Then we have chronic liver disease. And that is why it is not good when you have hepatitis, you leave it untreated. You don't have to leave it untreated. The earlier you find out that there's liver hepatitis, the more easier for treatment. And you know that liver is very, very important. They can cause a whole lot of problem in the body, because once it backs up, then there's a big issue, there's a big challenge in our body. So those are some of the things. And then if we want to prevent, how do we prevent? If we want to prevent, we look at, for those that already have vaccine, like the ERB, we give vaccine so that we can prevent exposure to those two. And then we avoid body sharing of needles. We have to go through safe sex. We have to avoid excessive alcohol consumption, and then we need to any foods vendor you are not sure of, because there's what we call any person that do those vendors are supposed to go through by they screen them to know if they can be of a good food handlers. In other words, as they cook, they will not transfer or contaminate the water or the food they are selling to people, which become a serious public health concern. So you most times as much as possible to eat what you prepare by yourself, except if you cannot avoid it. But how clean, how certified are these people you buy food from outside? And then the water we are drinking, like as you said, now it's not only from bodily fluid, we can also get it from water and the food we eat. Now, let me just stop here, and so that we can go through the questions for the day. And then if there's any other further question, we can take it up from there. Thank you, Mr. Awali.
Thank you so much, Dr. Victor. Thank you for that explicit and simple terms that you have used for us to understand what hepatitis can do. And I, sincerely speaking, I really want to appreciate you. And I was just going through some things as you are saying these things. They are very, very, very important for us to know so much about these things, because I started by saying ignorance is the worst disease that can kill a man. What we don't know is bigger than us. Now, so many questions came in from people even before this presentation. And one of the questions was, can hepatitis lead to cancer? That was number one question the person asked. And these are the questions we jotted down, so that the important ones, so that you can help us to clarify these things. The person said, can hepatitis lead to cancer? So I don't know if I can take all the questions, each of them as I'm.
Maybe we should take it one after the other.
Okay, sir.
One after
okay,
the
go
other.
ahead, sir.
Let's just take it one after the other. Can hepatitis lead to cancer?
Yes.
The answer is typical yes. The answer is typical yes. Hepatitis, chronic hepatitis B and C can actually increase the risk of developing liver cancer, which we call hepatocellular carcinoma. So yes, it can. And that is why I said earlier on that we shouldn't leave it when we have it for them to destroy and lead to something else, especially the cancer. Yes, it can.
Okay, thank you very much, sir, for that answer. And also, if you're in the house, in the group, you can also drop your question on the chat room. We are going to look at them and also take them one after the other. The second question, sir, was, how can hepatitis be prevented? How can it be prevented? Because from one of the research I saw, I was seeing that mother to child also is one of the way to transmit this thing. So I want to know how it can be prevented, sir. That was the question
just
of
like
the
as
person.
you said, that's true. Mother to child transmission is very, very, and that is why when a woman is pregnant and she registers for antenatal, one of the screening they will do for her is hepatitis test to confirm if she have hepatitis. And if yes, if she is positive, then we will monitor that pregnancy until she delivers. Where problem lies is during the course of delivery. As you are cutting the placenta, separating the baby from the mother, it must be carefully done in such a way that there's going to be a cross. Blood will not cross from mother to the child, whereby the child will not be infected. And that is why it's always done in such a careful manner, so that they will avoid that mother to child infection. Aside that, one of the ways we can actually prevent this is, like I said earlier on, is that we must go and take our vaccine. Vaccine A and B is one of the ways we can prevent it. In other words, once you take the vaccine, when exposed to this virus, you will not go down with the infection or disease. So that is one key way we can actually, prevent. And then another one is safe sex, one partner. If you are the type that will go for 1, 2, 3, it means you must protect yourself because you don't even know who is who. You don't know who has it and who does not have it. Like I said one of the body fluid, semen, is in the semen. It's been found in the semen, and it means you can even transfer it from semen through the semen to your partner. You understand? So that's another thing we must avoid. We must practice safe sex, and then safe food and water. We must make sure that the food we are eating and the water we are drinking is not contaminated with the virus. We can also avoid sharing of needles and sharp objects. You understand? So for those who are drug addicts that will probably, because of trying to inject themselves, probably share one needle or the other, they have to avoid that. Then those are the ways we can avoid it. Then we have to avoid excessive alcohol. We have to avoid excessive alcohol. Don't take too much alcohol because it can damage the liver. And once the liver is inflamed, that is hepatitis. All right? And like I said earlier on, we prevent mother to child. That's how we can actually prevent the virus or inflammation of the liver, which is hepatitis. Any other question?
Okay, thank you very much, sir. Thank you very much. Yes, sir. Some questions are coming in. And one of the questions was, I think they are like disagreeing. This country has the highest population of hepatitis patients. This one has. So this thing, can you quickly let us understand that aspect? Because a lot of time people, that, like I said, that discussion was on, I saw it somewhere where they're talking about it. So that this country has this high population of this than this. So, and I went to do some research about it. I discovered that in Africa, we have Nigeria, we have Mali, we have Ghana. So I just want to know what is your take about that, sir?
Yeah, in terms of the epidemiology of the virus, the way they are spread, of course, you will trust Nigeria. Reason, population. Reason is population. You understand? It's more prominent in this sub-region. And then newly developing countries are more prone to have more. Reason is that the healthcare system and then our attitude towards in the area of partners, multiple partners, have helped this thing to spread severally. You understand? So when you look at it now, you find out that most time, really, it's difficult to actually make this thing to spread, even from the food we eat and from water. But through body fluid, like semen, through blood, most times the high rates of infection is through body fluid, which is the blood and the semen. So for those 3 countries you're looking at now, it depends on who has performed the research and the indices they are using to measure which of the country has the highest rates. Well, I know it may not necessarily be one-on-one that we are the highest, but because of our population, you find out that the statistics will be pointing towards Nigeria, we're pointing towards Ghana, like that. So that's for that. But be that as it may, the onion is on us to be careful and avoid and see how we can prevent this thing from happening to us. For those who already have the problem, although there's a way they can help themselves and treat themselves. But for those who are yet to, as I speak now, I expect that after today, if you have never ever done such test, hepatitis test, A, B, C, D, go and do it. When you do it and you are negative, then those two that have vaccine, ask for the vaccination, take the vaccination to protect yourself, at least for those two first that already have vaccine, so that you can avoid further damage. Our liver is not something we should play with because it's one of the most important organs in the body. Thank you.
Thank you very much, sir. Just to bring to our notice for those who are just joining us, this month has been slated to be World Hepatitis Day. So Phytoscience take it upon themselves to talk about this amazing condition, which is a concern to everyone. And our guest in the house is Dr. Victor. And Dr. Victor, somebody is asking, can hepatitis be cured?
Okay, if hepatitis can be cured?
Yes.
All right. Yeah, for curing, yes, it can actually be cured. Hepatitis can be cured. Yeah. So there's antiretroviral drugs, medications. There's interferon injections and all that. So it can be cured. It can actually be cured. But when the damage is much, probably because of a wrong attitude of not taking care of yourself or not even detecting it early, then it becomes an issue. Like you remember, we established earlier on that chronic A and B can actually lead to cancer, liver cancer. So you cannot imagine when it has not led to liver cancer. So at that point, you're no more curing the virus or the hepatitis. You are now beginning to think of how to take care or cure the cancer, where you will probably now be going to do other cancer treatment procedures and all that. So yes, it can be cured when detected earlier. It can be cured, and the onus is on us now to always try to check up and see if we are positive, so that treatment can begin in earnest.
Okay, thank you very much, sir. We really appreciate your insight and wisdom about this thing. Now, some persons are asking for your contact. The fact remains that Dr. Victor is a consultant. What you need to do is to get back to the person who refer you to this Zoom, and the person is going to connect you to Dr. Victor for further consultation. And the last question here, sir, is it possible to treat hepatitis with stem cell? Is it possible to treat hepatitis with stem cells, sir? That is the question, sir.
All right. Okay. It's very, very, very possible to treat hepatitis with stem cell. Now, one of the unique things that stem cell brings into this treatment, this form of treatment, is this. Now, this is the liver. One of the organs in the body that can, on its own, regenerate itself is the liver. So even if, the liver is divided into two, there are two parts of the liver. Now, even if one part of the liver is off, the other remaining part can actually regenerate itself again on its own, even without stem cell. So now, when you now bring in stem cell into the treatment, it is very, 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 very okay. Now, in treatment of hepatitis, say for example, the one caused by the viruses now, if you want to treat hepatitis, now remember the liver is already inflamed. So it means that the liver will need some form of repair. Okay? In our orthodox form of treatment, whereby we can take antiretroviral, antiviral drug or medication to treat the virus, or interferon injections, what we are simply doing is that we are destroying the viral DNA, the virus itself, killing the virus. But after killing the virus, what happens to the remaining of the damage done to the liver? And so that's where stem cell becomes very, very important and very, very useful in this area, because apart from the fact that the stem cell will regenerate the liver, the stem cell also have been proven to have a good immunomodulation. Some of the extracts can destroy the viral RNA. Once the viral RNA is destroyed, the virus is dead. Because the only thing that the virus has is actually the genetic content, which is the RNA or the DNA. Once that is destroyed, the virus is as good as dead. So if you have, and that is why some of the drugs are targeted into taking care of the genetic material of the virus. Because it's through the genetic material of the virus that they can replicate and multiply themselves and then begin to cause problem in wherever they find themselves. Aside that, now let me just take one of the phytoscience products. Let's say the crystal cell, or let's even say double stem cell. It's called double stem cell because there are two stem cells there. The one from the apple and the one from which one again? Wale?
Burgundy grapes.
The grape extract.
All right, grapes. Now those are the two stem cells. Then there are other extracts. The grape, and then the acai berry. Now the extract, go and study how the extracts work. You will find out that some of them have the property of destroying the viral DNA. You will also find out that some of them have antioxidants. You will find out that they have some immunomodulatory property. Now, when you have all this, then you find out that the liver can be well taken care of. The virus that is causing the problem can be well taken care of. The stem cell to regenerate the liver back that's already damaged can be well taken care of. So, yes, the possibility of using stem cell to treat hepatitis is just there. But the thing is, in treating it, you need to consult your health professional to guide you. It is very, very, very important. You need to consult your health professional to guide you in using that. Because there's a whole lot of things you need to monitor while you are going through that treatment. So I think that answers your question.
Yes, thank you so much, sir, for that elaborate explanation. And you have heard it very possible. And some of the questions that is on the chat, majority of them has been taken care of by Dr. Victor, but only one I am seeing that we have not touched. Somebody asks if it can be transmitted through sweat.
Sweat, yes, to some extent, but the only way it can be transmitted through sweat is if you actually have an opening, like a wound. So the content in the sweat is very, very small. So except if you have an open wound, a cut, and then another person's sweat comes in contact with that cut, yes, one could actually get it. And especially when your immune system is low. Yes, it could be transmitted through sweat, but when there is an
Dr. Victor, are you there? Oh, I think Dr. Victor has gone off.
Yes, it's gone off. Wow.
I believe we are enjoying ourselves tonight. They said knowledge is power. So we have, in fact, I've gained a lot here tonight. And somebody saying, what about saliva? He has said it from the lecture. Please. Now we are going to go to show you some, Dr. Victor, thank you so much. We really appreciate you. So now we are going to help you. We are going to show you some products of Phytoscience that actually can deal with these situations. So permit me to share the screen. We are going to come back to take more questions. Just permit me to share the screen so that we can show you. Now, Dr. Victor was talking about some of our products, the double stem cell or the crystal cell. If you can see these two products, the amazing combination of products that can actually do what? Regenerate the cells. They can actually regenerate the cells. And imagine when it talks about if one of the liver is damaged, actually the other one can what? Regenerate. Now imagine you now have a product that can actually do this for you. Now stem cell therapy has come to stay, has come to change the narrative of stem cell of medication or treatment in the society today. Now, everybody are made up of cells. That's number one thing you should know. That is where the human being is formed. Now, from the cells makes up the tissues, makes up the organs, makes up the system. Now, if any health condition emanates, that condition started from the cells. Now, imagine now you now treat the cells. If you treat the cells, you have treated the tissue, you have treated the organs, you have treated the system. Now, the double stem cell and the crystal cell has the properties that can actually help you to take care of so many health conditions. You can see ranges from protect your longevity of skin, also improve your cellular health, blood circulation, so many health conditions, over 200. That's what this product you are seeing on your screen can do. And the difference, why this product, the stem cell therapy, is so important is because the application method is different from the way you consume your drugs, your supplements. Imagine you empty a sachet under your tongue that can activate 90% of your stem cells. Just one sachet under your tongue activates through the brain to the cellular level and works from the cellular level to the system level. Can you imagine that? So that is what Phytoscience products can give to you. So if you are looking for solution to any health condition, now you have it in front of you. Now we are talking about hepatitis, now which is a virus disease. And Dr. Victor has explained it deeply for us to understand how these things can be transmitted. And see, it is important. They say prevention is better, cheaper than cure. Now, like I said, everybody is made up of cells. Stem cells die. It diminishes with age and lifestyle. It means everybody on this planet Earth needs the stem cells. It's not until you are sick. You take it because for you not to be sick. Now let's move on. One of the products that is very important to everybody in the world is a snowy fort. If you are not detoxifying your system on a regular basis, your immune system, there is no way it will not be down. Now, normally we are supposed to do this 3 times yearly. Now, the snowy fort is antiviral, it's antifungal, it's antibacterial. So you can see that what is impacted in the product of Phytoscience is enough and capable to take care of any health condition. Even the hepatitis saw that had this condition in Delta State. And this doctor did not hesitate, and it took the snowy fort, it took the crystal cell and the double stem cell, and believe you me, And that was the end of that challenge. He took it and it worked for him perfectly. And look at it, the best aid in gastrointestinal issue, anything that has to do with intestinal problem. Balance your body acid alkaline count. If your body is too acidic, believe you me, your body is exposed to any health condition. But look at this, your body is supposed to be 20% acidic and 80% alkaline. And that is what the Snowy Fort will do for you. It also builds hemoglobin and the red blood cells. Imagine that. That's why it's excellent for sickle cell anemia and HIV and AIDS, hepatitis, and so on. So imagine you fight all forms of